Welcome. How do I do basic baby first aid? Every family household should have a first aid kit that's kept fully stocked. It could also be a good idea to keep a small one in the car or in a handbag or backpack in case of any incidents outdoors. But what exactly should it contain? A well-stocked first aid kit should have plasters or band-aids, bandages, sterile dressings, cotton wool, small scissors and tweezers, antiseptic ointment such as Savlon, infant fever medicine such as Calpol, a thermometer, preferably digital, and adhesive tape to hold bandages in place. Always remember to replenish any used supplies. Now, with this equipment ready, you should be able to take care of your baby should they get into any minor incidents. But what should you do if something a little more serious should occur? If your baby is bleeding with a small cut or scratch, wash it with some warm soapy water, dab it dry, and then place a plaster over it. For a deeper cut, put some pressure on the wound and keep the injured area raised so that any blood drains back into the body and not out of the cut. Place a sterile dressing over the wound before wrapping it in a bandage. If there is something in the wound or cut, such as a small fragment of glass, that can easily be removed, do so. Otherwise, have a doctor do it. What if they bump their head? All babies bump their heads at some point or another, and they're almost always fine. If they get a little bump, place a cold compress or a bag of frozen peas wrapped in a towel against the relevant area. Bumps on a baby's head can look rather dramatic, but this is normal. Speak to a doctor if concerned. However, if your baby bumps their head and loses consciousness, call an ambulance immediately. If a baby is choking, they will make noises that indicate that something is stuck in their throat, and their face will go blue. If either appears to be the case, lie the baby face down along your arm or across your knee and give them 5 sharp slaps in the middle of their back. Check between slaps to see if the obstruction has cleared. If the passage isn't cleared and they continue to choke, place them face upwards but horizontal on your arm or knee and use one finger to check for obvious obstructions in their mouth. If you can't feel anything, place 2 fingers at the lower half of their breastbone and press down sharply 5 times. Check their mouth once again to see if you can remove the obstruction with your finger, and if not, call an ambulance immediately. While you wait, repeat these steps. If your baby gets burnt, remove any clothing that covers the burn as fast as possible and run the sore spot under cold water for 10 minutes, even if the baby doesn't like it. Give them some infant painkillers as soon as possible. Once the 10 minutes is over, wrap the burn in cling film. Don't put any creams on the burn. All baby burns must be seen by a doctor, so book an appointment for your baby. Should you feel that it's more serious and that they need to be seen immediately, call an ambulance or get them to accident and emergency. If you think your baby's neck or spine may be hurt, do not move them and call an ambulance right away. If you're not sure what's broken, but fear moving them might cause more damage, call an ambulance anyway. If anything else appears broken, such as an arm or a leg, and you can move them without causing any more damage, very gently pick them up and put them in the car and take them to A&E. Support the broken bone with blankets or a pillow and don't let it hang or flop around. If a baby gets something stuck in their nose or ear, know that it really is quite common, as they love exploring their surroundings and trying to understand different objects. If you can do so easily, remove the item. If not, take them to A&E immediately, where a doctor can remove it safely. Don't touch it, as you might only push it in further. If your baby has received an electric shock, turn off the current at the main supply. Do this before touching your baby. or you'll receive a shock too and won't be in a position to help them. Stand on something like a large book or wooden table and remove the source of shock with a broom. Begin any necessary resuscitation and call an ambulance. If your baby has something in their eye, wash it out with water and try to keep them from rubbing at it. If a harmful liquid gets in their eye, lie them down and pour clean, lukewarm water into their eye for several minutes to flush out the substance. Your baby won't like this, but it's important. It's vital that the water isn't too hot. Eyes are very sensitive. If you don't feel it's helped sufficiently, you should take your baby to see a doctor. Finally, if your baby has swallowed something that you suspect might be poisonous and they seem ill, call an ambulance. Do not try to make them vomit. Even if they seem fine, call a doctor and seek the advice of a medical professional. Sometimes the symptoms present themselves later. If you can, bring the substance to the hospital for the doctors to examine. That's a lot of information to take in, and it might seem a little overwhelming. But if something happens, use common sense and trust yourself as a parent. So, to recap, it may be a good idea to partake in a first aid training day or course. While it's not absolutely necessary, it may reassure and calm you should anything happen. Trust yourself and use your common sense, but call an ambulance if you need to.